A tiny gold bullet against the coronavirus. This precious pellet, coated in a new prototype vaccine, has just started trials in mice. First results show it works differently to other vaccines already being tested in humans.
Here you can see big spots here. Each of those is a really good T cell responding to the vaccine, making the cytokine that's basically going to kill that virus.
It activates the immune system's killer T cells that clear infections from the body.
That means we've got a very potent T cell that can kill a virus very quickly.
Despite its promise, the vaccine can't get funding. The government has put £100 million into experimental vaccines being developed in Oxford and Imperial College London. But 90% of vaccines fail before they reach the clinic. It's a bet that may not pay off. And the other vaccines primarily work on antibodies, not T cells. It's an important difference. Not only should you get longer-lasting immunity, but also this one should work well in the elderly, precisely the people who need protection the most.
You just hold that against the arm and you just fire it into the patient.
The same T-cell technology has been used to harness the body's defences to fight skin cancer. Even those with advanced melanoma were far less likely to relapse. It gives scientists confidence that it would work against the coronavirus.
Trying to find a vaccine against melanoma, which is your own body but slightly abnormal, is a harder ask than a completely foreign invader. So I think if it can do that for melanoma, I think it's more likely to be able to do it for a virus.
10 experimental jabs are already in clinical trials worldwide. Like the Nottingham vaccine, they train the immune system to attack the protein spikes that the virus uses to get into cells. But that's the most likely part of the virus to mutate, which could make them less effective. So the Nottingham vaccine has a backup, priming the immune system to target proteins inside the virus. It's not only an insurance policy against mutations. Those proteins are common to other coronaviruses, so it could protect against the next pandemic. Vaccine specialists warn it's best to spread your bets.
The majority of the vaccine candidates are focusing on the spike protein, as that is the mechanism that we understand from coronaviruses of how coronaviruses get into the cell. So that makes most sense to focus on. However, having all our eggs in one basket, so to say, may not, and if that isn't the best approach, it will be good to have other options.
Keeping options open could be the difference between stopping the pandemic and not. Thomas Moore, Sky News, Nottingham.